Hey, Dr. James here. I want to talk about the different classifications of herniated discs and the difference between a herniated disc and a bulging disc, right? So when a disc herniates, it means that that gel material is starting to push out through the inner layers of the annulus. It may or may not have ruptured, but it's pushing out. If it sticks straight out, like if you're pushing down a jelly donut and the gel just kind of leaks straight out the side, we call that a protrusion. That's a subclassification of a disc herniation. If that gel material begins to either like sort of melt down like candle wax, or goes to the side or goes up, we call that a disc extrusion. And if a piece of that, whether it's a protrusion or extrusion, fragments off, we then call that a disc sequestration or a sequestered fragment. Lots of different terms here. Now, if the disc ruptures through the outer layer of the annulus, we call that a disc rupture. It's still disc herniation, but it's contained until we call it a rupture, okay? Extrusions can be both contained and or ruptured. So you're gonna hear these terms used interchangeably a lot, and it really is dependent upon the radiologist reading the films. A disc bulge is more of like if you're gonna push down that jelly donut, but the gel wasn't gonna leak out, and the donut would just sort of expand and bulge out, right? Those are broader. Disc bulges are broader. There's less tissue damage per se, but because they're broader, they can actually cause more neurological damage because they can push on both sides of the nerve canal, so it can hit both nerve roots as it's coming out, as well as the spinal cord. So the front border of the spinal cord is your disc, and that's why disc herniations can be so bad and cause so many problems for us neurologically. Anyway, I hope that short explanation clears up a little bit about the difference between a disc herniation, a disc protrusion, a disc extrusion, a disc sequestration, a disc rupture, and a disc bulge. All right, talk soon.